now with Dr. Sutton, and we are talking about the symptoms of sleep apnea when you are awake. That's what our viewers want to know about.
I think that this is such a great question because, to be honest, I think many people deal with sleep apnea and don't know. It's more than just heavy snoring. Sleep apnea is when you stop breathing. That increases risk to your brain and your heart. So some symptoms. First of all, having difficulty sleeping. If you're constantly waking up in the middle of the night and your partner who you're sleeping next to is waking up, then you probably should get sleep tested. Also, one thing that people don't know is untreated or difficult to treat high blood pressure. Blood pressure is one of the symptoms of not treated sleep apnea or sleep apnea that's not treated. And so if you're having difficulty controlling your blood pressure, you might want to get a sleep study because that could be a culprit.
Wow.
Many people do not know that. And so many people deal with difficult to treat blood pressure. And when we ask about sleep, it's not just trying to ask about your sleep as we always do. It's truly a signifier and it's also a cause. So you have to make sure.
Yeah. All right, your prescription for wellness.
Weightlifting. Both of you know I love weightlifting and I always think it's important to do it safely. Thank you. I was waiting for that feedback. Yeah, I was waiting. Yeah, I can barely fit in these suits.
Waiting for the compliments.
But it's important to be safe. And many people would assume that I lift heavy weights. Granted, my biceps is so large, right? No, but many people would assume. But I think it's really safe to start light and start quickly. So here's some quick tips to just be safe when you're starting to weight lift. Number one, warming up. It's really important to stretch. It's just as important as weightlifting. You can increase your risk of injury and hurt yourself. Also, moving weight unhindered and in a controlled fashion. Most injuries happen when you're lifting too heavy or you're moving too quickly. It's about moving slowly, going through the process, and really doing the movement correctly.
You have to feel the burn.
Feel the burn, resting between exercises, especially if you feel that burn, and then most importantly, don't overdo it. Know the difference between pain and strain, and taking breaks in between those weightlifting days is really important.
You want to talk to my trainer?
I know, because he's not buying it, right?
Really well.
All right, Doc, thank you. And folks, we would love to hear from you, so please hit us up on Instagram with all of your medical questions for Dr. Darien at ABC GMA3.